every femoral neck fracture looks similar on an X-ray until you draw one single line and suddenly the whole story changes. That line predicts how the bone will behave, how your fixation will perform, and sometimes how your case will end up in court. Imagine this. A 65-year-old lady slips and fractures her hip. In the OR, you stare at the X-ray. Will this heal? Will this collapse? Today on Osteon 0001, we decode Pauwels Classification. And here's a mind-blowing fact to start. Frederick Pauwel, the man behind the classification, was actually nominated for the Nobel Prize for his revolutionary work on bone mechanics, the very science underpinning modern orthopedic implants. 1935. Hitler's busy, but Frederick Pauwel is even busier. Amid rising injuries and unanswered questions in Germany, Pauwel sits with cadavers and protractors determined to crack the code of femoral neck fractures. Until then, surgeons only looked at the anatomic location and that was the classification used. But Pauwels flipped the script. It's not where the fracture is, it's what the forces are doing. When a person stands, force transmission at the hip joint is determined by the joint reaction force, which is the resultant of the forces due to the body weight and the muscle contraction. When the JRF hits the fracture line, it instantaneously splits into two components. Compression, that is the force which is perpendicular to the fracture line. It pushes the fragments together, stabilizes the fracture gap, and promotes bone healing. Shear, that is the force which acts parallel to the fracture line, attempts to make the fragments slide past each other. It destabilizes the fracture, which leads to non-union and further risk of implant failure. So look at the fracture line and ask, is the resultant force pressing the fracture fragments together or trying to slide it apart? A horizontal fracture line will have a dominant compressive component, so it is more stable. Now you tilt it vertical and the same force will try to slide the fragments apart. So from a biomechanical standpoint, fracture patterns may be categorized into three distinct configurations. In type 1, compressive forces dominate. In type 2, both compression and shear are at play. And type 3 is a shear dominant mechanics. Biomechanical stability follows a clear hierarchy. Type 1 exhibits the highest structural integrity, whereas type 3 has the greatest instability due to shear-induced displacement. The analysis of fracture orientation or the angle which the fracture line makes with the horizontal yields that angles less than 30 degrees correspond to type 1, all those between 30 and 50 degrees align with type 2, and those angles which are greater than 50 degrees are a characteristic of type 3. Hip fractures top malpractice charts, almost 14 to 16% of all orthopedic litigation. And the biggest chunk isn't surgical error, it's judgment error. Misread a type 3 as type 1 or type 2, wrong fixation, which means collapse and which draws further chances of a serious lawsuit. You need to document ruthlessly. 1 is to document both Pauwels and Gardens classification. 2, the prognosis note. 3, consent, especially in a type 3 fracture or an osteoporotic bone for the need of probable total hip replacement. So the next time you see a femoral neck fracture, don't just classify it, understand it. Draw the line, read the forces and ask yourself, am I working with physics or against it? For a 1-minute visual summary of Pauwels, the link is in the description and the post is ready. In the next video, we move from forces to displacement because Gardens classification doesn't care about the angles. It cares about alignment and blood supply. Stay tuned and stay stable.